Hi, I'm Chris Betts, RCPA Conference Committee member, and with me I have Dan Kebzu from Insight Telepsychiatry. Hi, Dan.
Hi, Chris. How's it going?
Very well, thank you. Thanks for joining us.
Absolutely. Excited to be here. And even though it's virtual this year, I'm hoping it's going to be a great conference.
I think it will. I think it will. So while we're here, what would you like us to know about your company?
Sure. Those of you who don't know me, I've actually been doing this conference for about 10 years, which is kind of crazy to say. But the organization isn't new to RCPA. The name is actually new. So Insight Telepsychiatry recently merged with another telepsychiatry group out of Chicago called Regroup. So now the name is Insight plus Regroup. Still at its core, the same mission, same services. It really just expanded our reach. Did make us the largest and national telepsychiatry provider. Hundreds of psychiatric prescribers that we employ and have partnerships really across PA and I think about 37 states now.
Wow.
So yeah, exciting time to be in telehealth, just with everything going on. But yeah, as a whole, we're a behavioral health provider and just help organizations increase access to care and get additional psychiatric capacity.
Very nice. So are there any specific specialty services you'd like to tell us about?
Sure. So I think our scheduled services operational model usually is of the biggest interest in this organization, just with the outpatient work that we do, can help bring specialty care, child and adolescent, substance abuse specialists into co-occurring programs and really just try to match the right clinician to line up with the partner that we have just to help them really because a lot of organizations struggle to find local psychiatry or prescribers and telehealth is really the next best thing and really kind of what everyone's had to use recently with COVID. So as I mentioned, it's just an interesting time to be in telehealth.
Sure. Yeah, thank you. And how has COVID-19 impacted your way of doing business?
So we were kind of virtual always.
Right.
So us, in some ways, it didn't impact kind of our day-to-day per se, but it has significantly impacted our partners and how they deliver care to the consumers that they work with. So really overnight, they had to learn how to do home-based telehealth and design workflows, design programs and ways to kind of reach out in the community that one, they couldn't do before from a regulatory perspective. And two, they just didn't have the experience. So it's impacted kind of our orientation in terms of how we design programs. It's definitely generated some more interest, whereas sometimes telehealth was just a Band-Aid. I think going forward, it's become more of kind of a strategy and kind of a must-have, where before it was kind of nice to have, but we've got some local folks. So it's definitely changed the dynamic. And if there's anything, I guess, as a plus that's come out of COVID, I think telehealth regulation and acceptability and receptiveness would be one of the few positives.
Definitely. Yeah, so you talked about virtual. So what is your perspective on doing everything virtually now? Has there been a big change for you?
Personally, not as much. Again, we've got a headquarters and main office in Mount Laurel, New Jersey, right outside Philadelphia, and don't go in too much. Some of our operational team still works out of there, and we do still have some providers who work out of the main office. But I've been kind of working in this remote space for a number of years. So for me personally, it wasn't too much of a transition to go virtual. Takes a little bit more to have a structured day and to keep things professional and not walk into the kitchen, if you will. But definitely things you just become acclimated to and just becomes like a normal day.
Very nice. Thank you. So what creative and innovative ways are you helping your clients?
Yeah, so I think I alluded to some of it. It's just really being flexible and meeting them where they are in terms of just rolling out services differently. A lot of the partnerships that we have clinic-based care, and that's really how we design the whole program. And as I mentioned, really overnight, as things started to shut down, we had to be flexible and had to make our providers flexible in how they connected with the consumers and the organizations we're working with. So that element of it definitely forced us to be creative, forced our partners to be creative. Also have a direct-to-consumer service, so that really had its time to shine. We can reach consumers more directly in their homes and just with the insurance changes, I think it's made it more accessible and for a lot of folks, because I mean, before that in PA, I mean, even Medicaid clients really had to be in a clinic to be able to get services in this way. So just more options and more creativity is kind of forced on us.
Great, thank you. Is there anything else you'd like to share with us, Dan?
No, I think we ran through pretty much everything that I wanted to share with the group today. Excited to be part of the conference. Love to meet some familiar faces in the booth, the virtual booth this year.
Right.
So definitely excited to see everyone. But I think that's it, Chris. Thank you.
Great. Well, thank you. Thank you. That's Dan Kebzu from Insight Telepsychiatry. Thank you very much, Dan.
Thank you.